Hi, Dr. Hardy here. This is part one of my series about boy boobs, aka gynecomastia, and I hope you enjoy. So, first thing I want to say is the definition of gynecomastia is basically when boys or men have abnormal growth of glandular breast tissue. So, this is a slide of a little boy holding his left chest in pain. Actually, I couldn't find a good photo of a boy in puberty. He looks a little bit younger than puberty, but basically, it's like a boy who might be between, 13 and 14 years old who complains of a painful lump under one of his breasts. And that is called physiologic puberty. And we'll get into both physiologic, which is kind of the normal course of development, versus pathologic, which is not normal or something. There may be an underlying disease or cause. So here's an older man where you can see some breast tissue in him. This is a slightly exaggerated picture, but I really wanted to get the point across because gynecomastia comes in a lot of different shapes and forms. It can be really small, almost like a cup breast on a boy or a man, or it can look very large. And of course, sometimes obesity plays a factor too. So what are the causes of gynecomastia? It's basically when male hormones go down in boys and female hormones are going up, and both male and female breast tissue respond the same to the female hormones, and so they start to develop breasts. Everyone has a little bit different sensitivity to the hormones, and it depends on the length of exposure to these hormones that will affect how rapidly they grow. So there are several causes of the hormone imbalance, because I know the next thing you were asking, like, well, if female hormones go up, male hormones go down, what would be the cause in some boys and not others? And so there are a host of issues that can cause this imbalance in hormones. And in small parentheses, I talk about neonatal breast hypertrophy, which basically is when babies are born and they have a little lump in their breast and sometimes a little milk comes out. And that's a physiologic cause, but at the same time, the reason why is because mom's circulating hormones are in their body still, and so female hormones are high in the baby's body and male hormones are low. So that's a perfect example, and as the baby grows and as mom's hormones get out of the baby system, now the baby's normal hormones, we're talking about boy babies here with gynecomastia, but it can happen in girl babies too. I spoke a little bit about pubertal gynecomastia, so that's physiologic when boys are in puberty and they may have a lump under the breast, but that's transient. And as they go through puberty, the testosterone starts rising, and so it shifts the balance to testosterone being higher than the estrogen in the boy. You can have some hormone secreting tumors, genetic syndromes, infections, and much, much more. The list goes on and on. So, to limit my time talking about it, I will not be talking about all of these different reasons. Drugs like marijuana can cause gynecomastia if you smoke a lot of it. But my population tends to be, of course, because I'm an obesity medicine specialist, usually I'm dealing with either children or adults who have elevated BMIs, and I usually screen them for gynecomastia because sometimes it's not just, baby fat or extra fatty tissue that's giving the appearance, and that's called pseudogynecomastia. So it's not true breast tissue under there, but it's my job to do a breast exam on these boys and see if they really have true breast tissue or is it just fatty tissue. So here it says elevated BMI, pseudogynecomastia versus true gynecomastia, conversion of male hormones to female hormones. So let me stop right there. So I talk about fatty tissue conversion of male hormones to female hormones versus fatty infiltration of the breast. So it is, they think it's, not a fact at this point, but studies about this are leaning towards the male fatty tissue in the breast actually converting these male hormones to female hormones. So think of these fat cells as little machinery bubbles, and within those bubbles of fat, all of this stuff is going on, activity is going on, and there are enzymes and proteins. And I may be going over your head, but just know that there's testosterone and hormone and other hormones in those cells, and we believe, or studies, are leaning toward the conversion as an enzyme converting testosterone to estrogen in the actual fatty tissue itself. So here's a picture of a breast exam. And basically the provider is pinching the breast at the base and moving forward toward the tip, and underneath the nipple or areola you may feel a symmetrical mass or tissue there. We call it fibrous tissue, and that's true gynecomastia. And this is a good picture because this man doesn't have huge breasts, right? It looks like a little, a girl who's just starting to grow breasts or something, but there is breast tissue under there. If you feel something hard and symmetric, we call it indurated or a little hard and symmetric. Whereas in pseudogynecomastia, there's no discrete ridge or demarcation of the glandular tissue under the nipple. So I hope you enjoy part 1 of this series, and hopefully part 2 will be up within the next week or so. Bye guys, I hope you enjoyed. Hi, Dr. Hardy here, and welcome to part 2 of Boy Boobs. So let's get started. In this part, I'm going to talk about important aspects of boy boobs, any associated complaints, and we'll answer the question, when is it worrisome? All right, so I spoke about the physical exam in part 1. Remember, a proper exam can differentiate pseudogynecomastia, which is fake, false, not true gynecomastia, versus real gynecomastia. So a proper exam should be done with the patient laying on his back with his hands beneath his head. And if there's breast discharge or fluid coming out of the breast, that could suggest a small brain tumor. Any skin dimpling, blood, green discharge, swollen glands under the armpits, that's associated with breast cancer. So as you can see, it is very important to get a proper exam, even if you are a boy. Elevated BMI can contribute to fake gynecomastia. However, there are people with an elevated BMI who still have true breast tissue underneath. So they also deserve a good physical exam. So here's a cartoon schematic of a boy's genitalia. And the top diagram, as you can see with my mouse, I'm pointing here to some dark straight hairs, and this is the beginning of some puberty. And as you advance in puberty, the hairs get darker and curly. And usually when a boy is in these stages of development, they may get a transient true gynecomastia. So a little bit of growth of the breast tissue, but then it's only temporary, and it usually happens during these stages of development. And as the boy passes through these stages of development, the gynecomastia goes away. So if your child is complaining of pain in the breast, or you notice some growth of the breast tissue and he is in this stage of development, it's probably okay. So this picture is showing a baby's genitalia, and there's a deep groove between the testicles. This is not normal. This is called a bifid scrotum. The scrotum should not have a groove in between. There should be communication between both testicles. And if the boy has this with gynecomastia, there is a problem. And even if he doesn't have gynecomastia, this needs to be worked up because later on he may get gynecomastia or other issues. So if there's gynecomastia, a bifid scrotum, or any other concerns, you have to start asking yourself, Does this run in the family? Are there any other men or boys in the family with similar issues? Does testicular cancer run in the family? Does the person with gynecomastia have an underlying kidney or liver issue? So medications can cause gynecomastia as well. I spoke about marijuana a little bit in part 1. So chronic marijuana smokers can develop gynecomastia, but there are also other over-the-counter dietary supplements and herbs that can cause gynecomastia. So you need to talk to your doctor about what medication your child is on and ask if that can contribute to the gynecomastia. So when should you worry? If there's rapid breast enlargement, that is not normal. So even with, pseudogynecomastia or transient gynecomastia, the breast enlargement is usually gradually progressive. It should not just be growing like super fast over weeks or over months. If the age of the boy is before 12 years old, that is not normal. If there's pain in the breast before puberty, so before 12 years old, or before those stages with a little bit of hair that's growing in the private area, that is not normal. If the testes don't seem to be growing with age, it's probably not normal. Other things to look for: if there's rapid growth in height before puberty, that is not normal. So when boys go through puberty, they go through a growth spurt. That growth spurt should be happening between 12 and 14 years of age. It should not be happening before. So that can indicate a problem. Also on exam, if or your child is super tall and lanky and has really long arms, your doctor can measure your child's arms and look at it relative to their height and see if there's a discrepancy. In other words, are the arms still too long based on your child's height? If so, that could indicate a genetic disorder, something like Klinefelter syndrome. Other physical findings: thyroid issues can cause gynecomastia. That's usually hyperthyroidism. An abdominal mass is basically a tumor in the belly that could be, secreting hormone, and that can cause gynecomastia. And if you notice some blue or dark spots around the mouth and they have gynecomastia, that can point you to a colon problem. So here is a video with the dark spots around the mouth. It doesn't have to be this pronounced. It can be just a few spots. So you should inspect thoroughly. You should pull your lips down and out and look all around for the spots. And this can point your doctor in the direction of a colon problem. Like I said before, an intestinal colon problem. So if you have the dark spots with gynecomastia and breast growth, this can give us more information as to what is going on. So I really hope you enjoyed part 2 of this series. Part 3 will be about the management. What do you do? Can you treat gynecomastia? And if you're enjoying this, just hit the subscribe button, tap the notification bell, and then you will be notified when a new video is uploaded. Thank you. Hi, this is Dr. Hardy here, and thank you for returning for part 3 of Boy Boobs. So in this part of the series, I'm going to talk about the management of physiologic or normal boy boobs that just is transient and will go away in time, and the pathologic boy boobs, meaning there is something wrong, there's an underlying issue, there is a problem that needs to be addressed. So with physiologic boy boobs, I usually just reassure them. I just reassure the parents that, if the boy is in puberty, he's in a certain stage of development. I showed you those diagrams in part 2, the little bit of hair growing, and then the hair gets curly, but it's not quite spread on the inner thighs yet. In those 2 stages of development, usually you'll have some transient breast growth, and then it'll disappear over a year or so. So I reassure, I observe, have them come back maybe in 6 to 12 months, take a look at it again. Of course, I tell them to come back sooner. If there's a rapid growth, it should never be a rapid growth of breast tissue. It would be slow and gradual. And like I said, most resolve within 1 to 3 years of onset. With pathologic gynecomastia, most of the time the workup starts out with labs. Then we think about medications, and then definitively surgery. So for the labs and other tests, one of the labs that is often obtained is the HCG, and that is a common hormone in women in pregnancy. That hormone is what turns pregnancy tests positive. But if we see an elevated HCG in a boy, this can alert us to a tumor, a hormone secreting tumor. So we will look at that and talk a little bit more about that after. Thyroid function tests are another issue, especially with hyperthyroidism. Boys may also get some gynecomastia. We'll look at their testosterone level. For example, a boy in puberty should have a high testosterone level. If they're in puberty and it's low, that is a problem. That's what rises at the onset of puberty. So if you have a child in puberty, but their body isn't showing any signs of puberty in the blood work, that is a problem. And usually when the testosterone is low, it's because their testicles aren't fully developed. Their testicles aren't secreting hormones that it should be secreting. And so, there's something called hypogonadism, which basically means small gonads, small testicles, and you need to work that up. That is often associated with some genetic syndromes, I think I mentioned before, like Klinefelter's, and some other issues, other syndromes. Another test that might get done is a testicular ultrasound, because if a boy has an elevated HSG, has gynecomastia, and a mass in their scrotal sac, and the testes is like maybe one is big on one side, you worry about that hormone secreting tumor being in the testicles. And then at the bottom it says imaging of the chest and abdomen, because you're also looking for a tumor in the chest or the abdomen. Sometimes a chest tumor can be associated with the Klinefelter's syndrome, like I said earlier. So we just start digging. So what's the least invasive? Getting a little bit of blood work, a little bit of some labs. After that, we're doing ultrasounds. After that, maybe CT scans, looking for tumors in the chest and the belly. So pharmacologic therapy, are there any medications to treat gynecomastia? No, not really. There is no FDA-approved drug to treat gynecomastia. There are some drugs that doctors will use off-label to try to help it or prevent it from progressing, especially in men with prostate cancer. They end up on medications that causes gynecomastia, and so sometimes doctors will give them another medicine to counteract that. Otherwise, another indication where you see doctors may use it off-label is if there's rapid growth in the breast tissue, the size of the breast tissue is more than 4 centimeters in diameter. That means it's pretty large. You can probably see it through a t-shirt. It might cause some psychosocial stress. So surgical therapy is the most definitive thing you can do. You remove the glandular tissue. Sometimes they have to do a little liposuction around it for cosmetic purposes, and so that the skin doesn't hang and things are symmetric and even and not, lopsided. But it's sometimes done even in physiologic gynecomastia if it's greater than 4 centimeters in diameter and causing a significant amount of stress. It may also be done if it was unresponsive to medical therapy, if the gynecomastia has been ongoing for more than 2 years, or if the boy is greater than 17 years old, and if it's associated with enough psychosocial stress that it's interfering with their daily activities. And of course, you always want to rule out other causes before you go straight to surgery. So that's why the labs are done and the CTs are done and the ultrasounds. And you're looking before, to make sure it's just breast tissue, maybe for reasons like the peripheral, what we said in the actual fat gland itself. It's this machinery that's going on in there, and the actual tissue is secreting hormone like estrogens into the bloodstream, but there's no tumor. It's just the fat itself is a gland, right? It's a gland. It's like functioning. It has purpose. It's not just, like just sitting there with nothing, to do. It's actually, has a metabolic process going on inside of those fat glands. And so it may be itself secreting some estrogen, but there's no other cause. So thank you so much for tuning in. This part of the series was a little bit shorter, but don't forget to subscribe and tap the notification bell for new video alerts. And of course, you can also, put something in the comments, some topics in the comments that you may want to hear about, and I can work on that for you. Thank you.